Sociodemographic data, or SD, includes information about people's characteristics like age, sex at birth, race, income level, education level, and more. These characteristics mainly describe who people are, but do not address the broader systems factors affecting health. Social determinants of health, or SDH, are the broader social and environmental factors, such as access to quality healthcare, housing, education and food, gender identity, racism, social support, and more. These influence a person's health and well-being and provide a deeper understanding of the factors affecting people's health and health outcomes from a systems perspective. Research suggests that social determinants of health account for 30 to 55% of health outcomes. That's a big impact. Understanding the difference between sociodemographic and social determinants of health data can be hard. Here's an example. Race is a sociodemographic factor that describes different socially constructed categories like Asian, Black, white, and others based on physical characteristics. But when systems discriminate against people of certain racial groups, even unknowingly, racism can become an important social determinant of health. Collecting SD and SDH data is essential for identifying inequities between and within populations. This information supports the development, implementation, and evaluation of interventions, policies, and programs to improve inequities. It is also supported by frameworks like the Ontario Human Rights Code, which aims to ensure equity in healthcare by prohibiting discrimination on grounds such as race, gender, and disability, and by requiring accommodations to the point of undue hardship. Similarly, the Excellent Care for All Act 2010 requires healthcare organizations in Ontario to prioritize patient-centered care and continuous quality improvement.
At Born Ontario, we are committed to expanding the safe collection of these data to help find where gaps exist and to work together with communities, healthcare providers, organizations, and policymakers to improve care and support health equity for pregnant women and birthing individuals and their families across Ontario. To guide this work, we are surveying healthcare organizations to understand current practices in collecting and using this data for quality improvement, planning, and care. We know how SDH and SD data collection helps clinicians, practices, and organizations learn about the population they serve, identify differences in risks and rates of disease, and conditions, and participation in care, and measure the success of their population or individual-based approaches. In the meantime, Born is collecting SD and SDH data in new projects, like the Pediatric Diabetes Initiative, where we've partnered with pediatric diabetes education programs to collect more detailed information on sociodemographics and social determinants of health of the patients they serve. This helps us better understand how social factors affect children's health and diabetes care, allowing healthcare teams to tailor support and resources more effectively. It's important that collecting and using sociodemographic and social determinants of health information becomes a normal part of care. When done safely and respectfully, it helps build trust between patients and providers and ensures that more responsive and inclusive care is provided. At Born, we're committed to taking thoughtful and respectful steps to include this information so that everyone's story counts.